So hey guys, what's up? It's Stephen Dunn with CORE Therapy and Pilates today, and what I want to do is interview Dr. Danny on his most recent education since he's been with us at CORE. So first of all, Dr. Danny, thanks for joining us today.
Sure.
And he's been working with us now for I think about 5 months.
6 months.
6 months?
6 months.
In that time that he's come on board to work with us, there's been a lot of educational opportunities that's already that he's already taken advantage of. And one of the things I like to do is get together and have a bio update. And we can update the bios on the website, but I like to just kind of have a discussion and talk about it because it goes into a much greater depth. And so with that said, next we're going to talk about a continuing education course that Danny and I actually got to take together recently. And it was a Myofascial Release course, which is something that I've been studying for about 15 years now with a guy named John Barnes. And he's the guy that coined the word Myofascial Release. And that word has become pretty common and well known over the last, say 15 years. But there's a lot of people doing myofascial release that say they're doing myofascial release, but it's not necessarily the way John teaches it. And I've been mentoring Danny now the whole 6 months that he's been here, teaching him craniosacral therapy from John's work, teaching him myofascial release. But to be able to actually go take a class and learn it in class from the people that I study with instead of just learning it from me, and then we got to work on each other for 2 full days. That was very, very interesting, and I'll get back to this in a minute from my own personal story of how this work has helped me with some stuff. But with that said, I want you to tell us a little bit about your experience with the Myofascial Release course. Again, it was his first course, more to be learned in that arena. But what was your take on that first exposure to really the work that got you interested in what I do from the get-go? So what was it like to actually be in that class compared to 5 years ago, watching, sitting on my table, sitting on my chair as I did it to other people? Tell me a little bit about that kind of experience.
Yeah, so I had a good experience with it. I think it's a great technique too, because a lot of it is, it's a lot more subtle than some of the other stuff that PTs can do that I've also been trained in, which is kind of like joint mobilizations, kind of like soft, traditional soft tissue, kind of like what people kind of think more like deep tissue / massage. Kind
of hurtful stuff.
Yeah, sometimes. And then doing joint manipulations, which I think, all of these have a place as well. But, it was also cool to learn, something on a kind of like a different approach where you can make some changes without necessarily having to dig into somebody. And we were practicing all of it, and we had a lot of the stuff done, and I could feel the different restrictions in my own body and see the changes after working on different things, working on your psoas, working on upper trap, all across the body. So it was very, very interesting and also just really cool, and I've really found that it can be super beneficial, especially with people that have any kind of autoimmune or fibromyalgia, because a lot of the traditional stuff with them, they can't tolerate it. Yeah, and it's very painful, whereas this is a lot more gentle, it's a lot more subtle, so it can make changes without having to really dig your elbow in or really pushing on joints and that kind of thing.
And something he mentioned, he talked about the hip flexor as well as the upper body all kind of thrown in one sentence. Myofascial release courses, this course we took, it wasn't like a neck course or a back course. It was a myofascial release course. So we learned techniques head to toe. And these head to toe techniques, they never once told us, do this for a back patient, do this for a neck patient. They said, do this for whoever needs it. And it kind of goes back to Pilates. What I was mentioning, a shoulder patient needs this strengthening work in their core. Well, they might need a psoas release to actually get their core in their back in the right position, a neutral spine, for their multifidus to fire correctly and their abdominals to work correctly. And so all of a sudden, for me as a practitioner back in the day when I learned Pilates 20 years ago, and I learned Myofascial Release 15 years ago, I'd already been looking at the whole body through Pilates. Mm-hmm. And John Barnes' work gave me permission to look at the whole body with my hands and feel with my hands everywhere. So if someone came in with neck pain, I might be working down in their quad and thigh because that's what they needed based on the assessment and evaluation and what we found. So with that said, it's a very powerful thing that when you look at the whole body, whether it's from an exercise with Pilates or from a hands-on perspective with Myofascial Release, it starts changing things because you address things that you normally wouldn't address because that's not what we were taught in school. We were taught in school, someone has back pain, you look at their back. They have knee pain, you look at their knee. They have elbow pain, you look at their elbow. And the reality is that it, takes a little bit more than that. So with that said, thanks a lot for your commitment to getting better and serving the people of Westlake and Austin. And if you haven't been around and seen Dr. Danny, then give us a call, get on his book. He's got some great Google reviews so far. We'll post those at the end of this video. But thanks for watching, and thank you, Danny, and we'll see y'all around.